You take a few steps, climb a staircase, and suddenly your breathing becomes difficult. What feels like simple tiredness could be a hidden problem developing deep inside your lungs. Inside every human body, the heart and lungs work as one team. To understand pulmonary hypertension, we first need to see how a healthy system functions. The right side of the heart sends oxygen-poor blood through the pulmonary arteries into the lungs, where it receives fresh oxygen before returning to the heart. Healthy pulmonary arteries are flexible and open, allowing blood to flow easily through the lungs with minimal pressure. Deep inside the lungs, millions of tiny air sacs called alveoli exchange gases. Oxygen enters the blood while carbon dioxide leaves the body. Pulmonary hypertension occurs when pressure inside the pulmonary arteries becomes abnormally high, making the heart work harder to move blood through the lungs. The disease often begins when the delicate inner lining of pulmonary arteries becomes damaged. This disrupts the signals that normally keep vessels relaxed. As pulmonary hypertension develops, important molecules like nitric oxide and prostacyclin decrease. Without these signals, blood vessels lose their ability to stay relaxed. As protective molecules decrease, another powerful chemical called endothelin-1 increases. It forces the pulmonary arteries to tighten, making it harder for blood to flow through the lungs. The artery walls don't simply tighten. Their smooth muscle cells begin multiplying, gradually making the vessel walls thicker and less flexible. Over time, the pulmonary arteries permanently change shape. Doctors call this vascular remodeling, making the vessels stiffer and far less able to carry blood efficiently. As the pulmonary arteries narrow, blood encounters increasing resistance. Pressure inside the lungs continues rising, forcing the heart to work much harder with every heartbeat. The right ventricle must now pump against unusually high pressure. Every heartbeat requires more force just to move blood into the lungs. At first, the heart adapts by thickening its muscle. But prolonged strain causes the right ventricle to enlarge, reducing its ability to pump efficiently. As blood struggles to move through the lungs, less oxygen reaches the body. Muscles and organs begin receiving less of the oxygen they need to function normally. Simple activities like climbing stairs can leave you breathless. Fatigue, chest discomfort, dizziness, and swollen ankles may gradually become part of everyday life. As symptoms worsen, your doctor examines your heart and lungs, checks your oxygen levels, and looks for signs that the right side of your heart is under strain. An echocardiogram uses ultrasound to create moving images of the heart, helping estimate pressure in the pulmonary arteries and assess right ventricular function. If pulmonary hypertension is suspected, right heart catheterization confirms the diagnosis by directly measuring this pressure. Although it cannot always be cured, modern treatments can reduce pressure, relieve symptoms, slow disease progression, and improve quality of life. Treatment also includes healthy lifestyle choices. Staying active within your limits, eating a balanced diet, taking your medications as prescribed, and attending regular checkups all help manage the condition. Pulmonary hypertension often develops slowly, making early diagnosis difficult. Recognizing persistent breathlessness and seeking medical advice early can make a significant difference. Thanks to advances in medicine, many people with pulmonary hypertension can live longer and enjoy a better quality of life with the right treatment and ongoing care. Understanding pulmonary hypertension is the first step toward recognizing the warning signs, seeking timely care, and protecting every breath and every heartbeat. Subscribe for SunnyBody for more health tips.